You ready? Imagine that you are responsible for an elderly relative who is veering quickly towards end of life. You have not been in this situation prior and you are unsure of the correct decisions to make that would be the most beneficial to your relative in order for him or her to maintain a high level of comfort while in the active dying process. What options do you have? How can you explore these options? Who do you talk to in order to make the best decisions for your loved one? Doctors have the information you need regarding end-of-life care. The information given by your loved one's primary physician can influence your decisions for care. End-of-life care is the total care of a person with an advanced incurable illness and does not just equate with dying. End-of-life care phase may last for weeks, months, or years. This care helps the person to live as well as possible until they die. Hospice is defined as care designed to give supportive care to the people in the final phase of a terminal illness and focus on comfort and quality of life rather than the cure. The goal is to enable patients to be comfortable and free of pain so that they live each day as fully as possible. Aggressive methods of pain control may be used. Hospice programs are generally home-based, but they sometimes provide services away from home in freestanding facilities, in nursing homes, or within hospitals. As a nurse on a long-term care unit as well as a skilled nursing unit, I see many of these heartbreaking cases. We do our best to explain the dying process to the family and give them comfort, but the family may have multiple questions and concerns regarding the comfort measures. This is when we have the doctor meet with the family and sometimes the patient to explain the diagnosis and treatment, including any comfort measures. I have personally seen many families be influenced by our primary physician when making end-of-life decisions. Our primary physician is a caring advocate for our residents' comfort through the entire stay on the unit up to and including passing away. He ensures that our nursing staff provide the best hospice care for all of the end-of-life care residents on our unit. Families tend to understand and absorb the information he gives better than any other discipline involved in the process. According to a study published in the Health Affairs magazine in June 2015, researchers reviewed information on nearly 199,000 cancer patients in the United States who were eligible for hospice care because they were dying. The average age was 78. The information was gathered between 2006 and 2011. 2/3 enrolled in hospice care. Those who chose hospice were more likely to be women, white, and live in higher income areas. The investigators found that the patients were more likely to enroll in hospice if their doctor had a high number of patients in hospice care. They found that patients were 27% more likely to enroll in a hospice care program if their doctor was in the top 10% of doctors using hospice care compared to those whose doctors were in the bottom 10%. End-of-life care is not an easy decision, and speaking with the primary care provider can benefit not only the terminal patient but the family as well. A doctor is more likely to refer a terminal patient to hospice services if he has many patients in hospice care already.